Hi, Dr. Keith Smith is joining us for what we hope to be a pilot episode of a Free Market Medical Association Shop Health video blog. I think, Dr. Smith, you are the king of video blogs. You've been doing this for a lot longer than I have, probably before the Free Market Medical Association was even started. So I thought you would be the first person that we would have on to talk about some things today, and then hopefully going forward we'll have lots of great things to talk about with you and Jay Kempton and other people. But I thought today, for maybe our first video blog, what might be nice to do would be to talk a little bit about our upcoming conference, which is going to be here very soon, April the 30th through May the 2nd in Dallas, Texas. It will be the sixth annual conference of the Free Market Medical Association. And we just wanted to talk to our members and potential members, anyone that's interested in coming, a little bit about the conference, what it's going to be about, some of the speakers. And so tell us a little bit about the theme of the conference and why we chose that.
Yeah, I'm very excited this year. Our theme is entrepreneurship. It's something that I've become very interested in. There's actually a lot more to it, I think, than most people know. As far as I'm concerned, the world experts on entrepreneurship will be speakers at the meeting. I know, correct me if I'm wrong, I know Peter Klein has agreed to speak. And have we heard from Per Byland?
Yeah, I think he will probably be joining, but for sure Hunter Hastings, who is serial entrepreneur, marketer, worked for Procter & Gamble, and an economist also. So he and Peter Klein will both be there.
Now these are the world's experts, as far as I'm concerned, on really the study of entrepreneurship, and there really is more to it than I think most people know. I think that the employers in the room who are entrepreneurs will feel vindicated as they hear these speakers and think through the decisions they made, how that they bridged their gaps in knowledge. What was that element of their own entrepreneurship that helped them cross that kind of faith bridge over the uncertainty when they decided to start their business? And I think that the employers in the room will get a lot of ideas about how to think through future challenges, and these speakers will provide a lens through which they can see future opportunities or even re-examine their current ones. I think the physicians in the room need all the entrepreneurial advice and help that they can get. Physicians tend to be poor at thinking through entrepreneurship, I believe, because we are very appropriately risk averse when it comes to dealing with patients. And that same risk aversity is transferred to the business side of our practice. And I think there's much more to that. I don't want to spoil the conference or give the punchline prematurely, but it's actually a very exciting topic. And I think everyone will walk away with a lot more knowledge than when they came in, and feel energized like they typically do after our conferences.
Yeah, unfortunately, I think in the current healthcare system, the way it's constructed, it's become so corporatized that people tend to think, and even doctors don't like to think of themselves as business people, or they want to shy away from thinking about a patient as a customer a lot of times. So I'm hoping that we can provide an antidote for that, to sort of bring back the idea that it's okay to think about a patient as your customer, and that does not devalue the patient or the physician in any way.
Yeah, I think that is very difficult for many physicians to say, here is what I do, and here is how much I believe I should charge for that, and allow the market to judge, whether that decision is consistent with the preferences of the buyers in the marketplace or not. That's very foreign to most physicians, and most physicians I know, myself included, when someone comes along who has difficulty raising the funds that we believe represent a mutually beneficial amount for the exchange, most physicians I know are willing to discount or be charitable to some extent with patients on an individual basis. And I think that's important for the understand, is that their ability to be charitable is in no way interfered with this sort of approach to practice. If anything, I believe it is empowered and energized by this approach to practice.
Yeah. And, at the risk of sounding like a politician who says this is the most important election ever, I kind of do feel like this might be one of the most important conferences that we've had. It is something, like you said, that really hasn't been discussed enough. And also, I just feel like our movement is about to reach a critical mass. And if we start thinking this way, we can show that a lot of the good things that have happened in the free market medical movement can be scaled up to meet the needs of larger buyers, larger employers.
Yeah, I agree. And I also think it's important for the buyers and the sellers to be in the room at the same time, exposed simultaneously to these thoughts of entrepreneurship from these, heavy hitters, sluggards like Hunter Hastings, who can explain the concept of entrepreneurship to the buyers and the sellers at the same time. I think that it'll be very healthy for the buyers in the room to know and to be witness to this information actually being delivered to the sellers. And again, I think many of the buyers in the room are already entrepreneurial, and they will learn a lot and be vindicated. I agree with you. We really are at a tipping point, and I think that this whole idea of honesty, cheaper and better, those are things that are really hard to argue with if you're on the other side. The only way to argue with those is to take a very hard line socialist position, which I think is increasingly difficult to defend. It doesn't mean that there aren't tyrants who will pursue that. There are plenty of folks out there that would like to have complete control of this industry for their own purposes. But I think this movement really is at a tipping point. I think we're seeing the effects of this movement on a widespread basis. There are some people who are not saying Free Market Medical Association out loud, but there are people who, like at the executive order, when Trump was speaking, he sounded like a card-carrying member of the Free Market Medical Association, and indeed, one of the people whose advice he relies on most heavily, Larry Van Horn, is going to be our keynote speaker Thursday night. So I agree with you. We're at a tipping point, but I think we also have to acknowledge the extent to which the FMMA has already disrupted and modified the marketplace. And I think that in areas of the country where there is not a free market exchange in healthcare, I think it's coming to those areas soon. People are going to be steamrolled by this, whether they like it or not.
Yeah, it's very exciting. And as you mentioned, Dr. Larry Van Horn from Vanderbilt University, who was really the chief architect of that executive order that was signed last year, and who's been a strong proponent of transparency and cash market in healthcare for a long time, is a great speaker. He will be at the conference along with some familiar faces that we've seen in the past, like Adam Russo from the FIA Group, of course, a good friend of ours will be there. several other people. John Harvey is a great broker member who is from Arizona, I believe, will be there to talk about success stories. I think one thing too that I hope will set this conference apart from others, in particular, maybe things in the past, is for us to move even more. I know we're a very practical organization, boots on the ground, grassroots organization, but to really highlight, especially for the employers, the successes that employers have had in following this model. So many people know about your story, but we want to tell, and the Kempton Group and how you guys have worked together. But I think there are many other great stories out there that can be told. Some very successful entrepreneurs like Sona Pharmacy in North Carolina, who basically decided to start their own transparent pharmacy benefit manager, and it's almost unheard of. And so they will be there talking about some of their successes. We have the Oklahoma Proton Therapy, the Acarant group that puts together bundles for major medical services as well as ER services. So we're gonna really be talking about a lot of things that people haven't talked about, and people have thought, well, the market can provide primary care, direct primary care. We sort of figured that out, although there's still a lot of room to grow there, I think. And then people might say that, well, the market can provide for these, quote, predictable surgeries that the Surgery Center of Oklahoma does. But I think we're going to be able to demonstrate that the free market can work in all those many areas above and beyond that.
Yeah, Dr. Per Byland, one of the attendees and hopefully speakers at the conference, made a point in a Twitter war recently to one of the trolls that a functioning market place is a manifestation of the end goal of market principles. So when people want to point out the holes, the areas where market pricing does not exist, that is simply a matter of time. It's not you flip a switch and it happens. And you made this point, James, the other day in an interview when you said over time the number of services provided to which a price is not attached has shrunk, and it's shrinking every day. And like you said, direct primary care, well, that's all well and good, but what about surgery? Okay, outpatient surgery. Okay, you cherry picking guys, with all this predictable surgery, anybody can tell you how much a hernia is. What about cardiac surgery? Okay, well, we have cardiac surgery being provided for a fixed price. Okay, what about emergency room? Well, okay, we have the OKER and hospital. Those guys are providing transparent pricing for emergency room care. And we have the proton folks now in oncology. And every day that goes by, there are fewer and fewer modalities of care to which a price is not attached. We have Acarant Health this year. They're providing pricing for very complex procedures. And so I think that Dr. Byland is right, and I think you've been right, that as time goes by, the amount of uncertainty shrinks, and it will never go away. But that's why we have insurance, and that's a point that people forget. We're not saying no one should have insurance. There's always going to be some uncertainty, and to the extent that a buyer's preference wishes and is consistent with reducing that uncertainty, insurance has a place. So I'm very excited, like you are, about this conference, and I think it will be a conference unlike any other that I know the physicians attend, and I know the buyers will never attend a conference that will have information like this.
Yeah, let's talk now about our goal of having more students come to the conference. I think that's a good segue to that. I don't believe, you can correct me if I'm wrong, but I'm guessing that most medical students have not had almost an ounce of business classes in medical school, much less what entrepreneurship means and how to operate in that in the midst of uncertainty. And of course, what the government always likes to do is come along and say, look, we can provide some certainty for you. And that filters down to, the sort of the corporate mindset. If when a student graduates from school, they can see some certainty in their future if they're promised a 5-year employment contract or something like that. So we want to get ahead of that and bring more students into this mindset. And so talk a little bit about that, what we're planning on doing, and we want provide some opportunities for people to help those students.
Yeah, I actually taped a video earlier today that I hope comes out later in the week, which was an appeal to FMMA members and non-members, people who aren't going to attend the conference, to help us raise the money necessary to scholarship 25 students. That's our goal. The reason being exactly what you said. The medical students do receive business training, and it's all bad. It's all socialistic. Mm-hmm. I was extremely fortunate as a resident to be trained by some academicians that had formerly been in private practice. And so they were actually able to pass along some very practical wisdom and points about how to survive in the real world. And they also let us know that you could survive in the real world and that you didn't need all these hospital and government guarantees, that you can take this uncertainty bull by the horns and run with it, and you'll be successful. And to the extent that you take risk, you probably will be even more successful. That is not the message most medical students are receiving now. If anything, they're receiving the message from the fools at the American College of Physicians. This week, just recently, recommended a single-payer Medicare for all kind of system. And that is the kind of message medical students in particular need to be inoculated against. And I'm hoping that there's a response to our appeal and our plea to raise this money. I think a total of about $16,000 will bring 25 medical students, and hopefully there'll be enough people that will pledge, $5, $10, $15. It won't take very many people to raise that kind of money. We'll get the students there, and then you'll know that there are physicians out there who are ready to work for the patient and not work for the government or some big price gouging hospital system. I know that as I age, I'm going to want physicians who work for me and are not conflicted and are not working or paid by someone else.
Yeah, I was about to say the Free Market Medical Association is just a great opportunity for physicians like yourself and direct primary care physicians to provide some mentorship to these students. And as we're seeing some direct primary care practices grow to the point that they are able to take on more and more patients, a lot of them are looking to bring on, new physicians to sort of mentor them and get them into their practice and really make them more of a partner versus an employee.
Yeah, and it's important for the medical students to actually lay eyes on the unicorn that the academicians say does not exist. And that is the private practice doctor who is actually not surviving, but thriving. And the academicians many times, I believe, work very hard to convince the students that's an impossibility, that in order to survive and pay off these ridiculous student loans that the government loan shark has inflicted on you, that you have to take a job at a hospital. And so for medical students to actually meet and shake hands with some of these risk-taking entrepreneurial heroes that are in the room, whether they're primary care doctors or orthopedists or whatever their field is, for them to see that and also to see, here are people in the room that want to buy these services and actually prefer the services that an independent doctor provides to those doctors who are employees of price gouging hospital systems. This is all important, and I think that if I were a medical student, my neck would hurt because I would turn to the left and see the doctors that are actually selling these services at a fair price, really care about and work for their patients, and then they look to the right. And here are all of the employers that represent the demand. Another part of what I believe medical students are told simply doesn't exist. In order for you to survive, you have to take your money from insurance companies and the government. And lo and behold, here at our annual meeting will be, this source of demand that the medical students are told just simply doesn't exist. So it's hard to overemphasize how important it is for this real world sort of practical experience and for the medical students to engage in that.
Well, I'm really excited about it. Hopefully we've conveyed to the viewers that this is going to be a conference that they don't want to miss. If they're not already members of the Free Market Medical Association, they can go to our website, fmma.org, click on the events. Well, you can join there, and you can also click on the events tab to find all the information about the conference. Again, that's April the 30th through May the 2nd in the Dallas area. Very excited about it. And also on the website, you can find the way to support a student for this conference. So appreciate you being on, and let's do it again soon. Thanks so much for coming.
Thanks, James. Thanks for everything you're doing.
Thank you. Bye.
Bye-bye.